All right. Hey guys, it is Jenny on the block here at Fox 8, and I'm talking to Dr. Urchek. He is an orthopedic sports medicine surgeon, so super cool. Today we're talking about rotator cuff injuries, and I've definitely known people who have had this type of injury. So let's talk a little bit about it. What does a rotator cuff do in your body?
Good morning. Thanks for having me on. So, the rotator cuff simply is a group of four muscles and tendons. The muscles start off of the shoulder blades, some on the back, some on the front, and then they kind of conform to one tendon that comes to the outside of the shoulder here. The purpose of them is to stabilize the shoulder so then our bigger muscles, like our lats, the deltoid, they can actually move the arm in space.
Interesting. So, what are the leading causes of rotator cuff injury? Because, like I've said, I've known people, but to be honest, I can't remember why or how they hurt themselves. So, what are the most common?
Sure, there's a couple of different ways. The most common is from overuse or bad luck. And finally, in my life, I'm starting to deal with some myself. I see all the patients. It's the most common thing I see is an overuse type of injury, which typically leads to inflammation. You may hear your doctor say rotator cuff tendonitis or bursitis, but it's basically overuse of those tendons. It typically comes without a big trauma. It leads to pain on the outside of the shoulder. That would be the most common thing that I see. The more feared injury would be that rotator cuff tear. Almost every patient says, how do we know there's not a tear in there? Thankfully, that's usually more of a trauma. So this time of year, you slip on the ice, you brace or catch yourself from falling, landing on that shoulder. And then one day, all of a sudden, you have pain on the outside of your shoulder and maybe a lot of weakness. That would be more of that rotator cuff tear phenomenon.
Okay, so even though it sounds like the rotator cuff kind of is in a bunch of places over here, the most common is pain, you said on the outside?
Yep, exactly. So most of us would think the shoulder joint would hurt kind of in the front, and although you certainly can have pain there, it's almost classic. I'll have a patient that says, I don't know, a couple months ago, I was painting my house, gardening, doing yard work, and now I have pain, and it even goes down to my elbow without even talking more or listening, it's almost like, yep, that's going to be a rotator cuff problem. So the most common symptoms would be pain on the outside of the shoulder. It would be pain when your arm is away from you. Classically, patients will say, hey, when my elbows are close to my body, I can do whatever I want. But once it starts to get above my head or behind my back, that pain comes. And then the number one common complaint is night pain. So
Mm.
a lot of times patients can do their work, do their life, and they kind of just deal with the pain. But as soon as their sleep starts getting affected, that's when they classically come to see me, or maybe even their significant other says, "Hey, you got to go see somebody because you're keeping me up at night." So that's the most common complaint.
Got it. Um, Now, obviously, you talk to people all the time about their rotator cuffs, but can it heal on its own? Like if I just ignore it and just let it ride, is that going to go away?
It can. So it comes back to why is the rotator cuff hurting? So if we keep it between those two groups of patients, and overuse, inflammation, tendonitis, bursitis, yes, those patients with a little bit of luck, they could just get better on their own. Let's say again that they were doing a new activity, they kind of rested, let it heal up. That certainly can get better in a couple of weeks or even a month or two.
Mhm.
We classically add in some things for those patients, like Aleve, ibuprofen, ice, or most importantly, like a good physical therapy program or home exercise program.
Mhm.
A lot of times we think that as long as we're doing shoulders or a chest workout, arm workout, we're working those rotator cuff, but the rotator cuff muscles are really kind of small and deep in there, and it's special exercises. So you may have to add those kind of things to get it to heal up. But thankfully, with a little bit of time, luck, and maybe a couple of these things we're talking about, it can heal up.
Okay. So when should I sh see a specialist?
It would go back to the a couple of things. Number one would be if it is just out of the blue, the pain came on, and we just went through some of these things we talked about, Aleve, ibuprofen, giving it time, and a month or two or three goes on, and if it's not getting better or certainly getting worse, keeping you up at night, that's when I would reach out to my doctor or go see a specialist about the shoulder. Now, if you're one of those patients that unfortunately slipped on the ice or did something and fell, and within even a couple of days or a week, you notice that you can't even raise your arm up, the pain's pretty bad, you have lots of weakness, that's something you may want to see a doctor or specialist sooner. Because again, if you have a rotator cuff tear, it's kind of a different problem to have and something that we may have to jump on a little bit sooner.
Got it. Um, okay, so how do you diagnose or treat? I mean, we talked about treatment, but how do you diagnose it? Is it like a scan of sorts, or is it just them telling you about the pain? What's the protocol?
Sure. So again, patients coming in, it's almost like I can listen to the shoulder without even examining a patient. We've talked about it. If a patient comes in, hey, a couple months, no trauma, my shoulder's hurting, keeping me up at night, I can do everything. It just hurts to do it. I can almost, pretty confidently say that's a tendonitis bursitis. But certainly we examine the shoulder as well. Now, again, if it's a rotator cuff tear where we think somebody fell, they have weakness, or if they've been dealing with this for a long time, they've had some treatment, it's not getting better. Certainly, we'll start with x-rays. That helps us to rule out arthritis because arthritis can mimic this type of problem as well. And
Mhm.
if those look okay, and we're still concerned that the patient isn't getting better or there may be a tear, then classically we'll get an MRI if the patient is able to. An MRI allows us to see actually those muscles and tendons attaching to the bone and if there is a tear in there that we have to address.
Okay. Um, and then as far as recovery process, so let's say someone does have some sort of injury to the rotator cuff, what is the recovery process? And I'm sure it depends on the type, but give us a couple
Sure.
examples.
Sure. So if it's that tendonitis bursitis, a lot of times, again, we do the Aleve and ibuprofen, the physical therapy. That is a common area where I will do a cortisone injection. It's common for patients to fear the common or the cortisone injection, thinking that it's just masking the pain. But I tell patients again, a cortisone is an anti-inflammatory. It's like a super duper ibuprofen. So we're actually putting it right at the source of the problem, which is inflammation. So it's actually treating the problem. So if that's the route we're taking, usually in a month or two, patients are feeling really good. Now, the harder discussion would be if there's a rotator cuff tear,
Mhm.
and depending on the patient, they want to get back to their activities. There's a significant tear in there. Now, sometimes we are talking about surgery, and a lot of times patients will say, "Oh my gosh, my husband or my wife went through this, or I have a friend or colleague at work, and I know it's a long road in recovery." So, briefly, with a surgical option and fixing the rotator cuff, the recovery process is certainly drawn out. And because we need that tendon and bone to heal back together, that just takes time. So patients after surgery typically are in a sling for 6 weeks, and there's healing that happens for about 6 to 9 months. There's even some research that full healing is about 10 months. So it's not typically a surgery patients are running to have, but again, if you have to have it, you have to have it. And typically, if you do the surgery, the therapy, and go through that recovery process, patients are pretty happy afterwards.
Okay. And then, of course, I always think prevention, such a good idea. So how do you prevent rotator cuff injuries?
Sure. Some of it goes back to the good luck, bad luck type of phenomenon. And, hopefully you have good genetics and things like that. But going back to what the rotator cuff muscle and tendons are, it's those four muscles and tendons. They come off the shoulder blade or the scapula. The
Mhm.
shoulder blade actually has 17 muscles attached to it, four being the rotator cuff. So what typically happens is there's just so many moving parts, so many muscles attaching to the shoulder blade, attaching to the arm, your rib cage, that it's easy for it to get out of whack, if you will. So that goes back to the physical therapy and exercises. And it is an area where if I have patients that have these shoulder issues, and now unfortunately I'm starting to feel it myself, I do tell patients it could be somewhat of a lifelong journey or treatment process, going back to like you asked about prevention. So I go back to those rotator cuff exercises and keeping them healthy. And I have found with patients that if your shoulder becomes 100% better, even if you had an issue, if you just do those a couple times a week, you kind of stay on top of it. Usually that's the best thing to prevent this from coming back and having to see somebody like myself for more injections or an MRI if it's not getting better. So it goes back to those exercises, keeping it healthy is probably the best thing you can do for prevention.
Awesome. Well, I learned a lot today, so thank you so much for being here. If you guys are interested or are having any rotator cuff problems right now, you can go to sumahealth.org/orthopedics, or you can call 888-905-5430. And again, thank you, Dr. Urchek, for being here and talking rotator cuffs with us.
Of course. Thanks for having me.